Welcome back. The government is back open with a new deal for a budget and a new deadline for a budget deal and a health care website that's plagued with problems. Joining us with his take, Republican Representative Sean Duffy. Good morning, Congressman.
Good morning, Sean.
So the last time you were here was just before the shutdown. Obviously, that was kind of a month of turmoil. To paraphrase Ronald Reagan, are we better now than we were a month ago?
Yes, the government's open. It's running. Yeah, I think we're far better off. We put the shutdown behind us. Looking forward, we're going to have budget negotiations, but I think you see people more committed to working together and getting this job done and putting the brinksmanship behind us and seeing more people work in a bipartisan fashion.
So is there at all an emotion on anyone on Capitol Hill that, hey, we did the American people wrong, we got to make up for it?
Listen, people still are concerned about the debt. They were concerned about the Obamacare rollout. But listen, America wants their government to function and function well. I think if you ask people, they're mad at Washington, at everybody.
Yeah.
And I think it's important that everyone start coming together and working in a more bipartisan fashion.
Now, the House Republicans were kind of dead set against this Obamacare implementation, and the website's been plagued with problems. Do you see this as kind of maybe doing your work for you and setting people against the Obamacare website?
Well, we were concerned that the rollout wasn't ready for prime time. And when on October 1st we saw the website wasn't ready to go, and the president, frankly, could have joined us for a delay, whether it was a year like we had asked for, maybe he would have said 6 months. So that was a problem that we saw. And we also knew that the president was making a promise that people could keep their health care if they liked it. We knew that wasn't true because of the mandates that were in the law. And so that was a concern for us, as a lot of people in central Wisconsin were losing their health care coverage. They were getting notices that their insurers were going to drop their plans. That was a concern for us as well. And I think there's ways to tweak that and make sure we take away some of those mandates, so a 55-year-old woman's not buying maternity coverage and a young guy is not buying hip replacement coverage. That could make it work a lot better and bring the cost down. So there's some reforms that we could do to actually make this thing work.
So how likely is it now to change that? How easy would it be to change that now that the law is kind of going ahead?
Listen, first of all, I don't think it's going to increase access and reduce cost. I still believe that. But the president is the president, and unless everyone agrees, this law is staying here while the president is in office. So we have to work together to figure out, how do we make it better? How do we actually help the people who are losing their coverage, or people who are able to get into the exchanges? There's not many of them, but those who get in, how do we help them find a plan that is at a price that they can afford? They're seeing the prices go up and the deductibles go up as well. Very challenging for a lot of people here.
So now the cuts to the food stamp program have hit Wisconsinites hard. This was only meant to be a temporary benefit, though. But what do you say to the family member who walks up to you and says, hey, I was really counting on that $30 a month to feed my kids?
First of all, I wasn't in Congress when this stimulus bill passed and they ramped up the food stamp spending, and it was slated to go away, and that's what's happening right now. So I had nothing to do with the ramp up or the ramp down of this. But we have in Congress tried to make some reforms to the program. First off, I want to make sure that kids that don't have enough food to eat, they have food to eat on the table, and families that have come upon hard times, I want to make sure we're offering them a helping hand up. What we've done with the reforms, though, is said, listen, if you're an able-bodied man or woman and you don't have dependents, mostly kids, you got to either get a job or you got to get a job skill. You got to go to school. You can't just sit at home and watch Sports Center or go ice fishing and get food stamps. You got to get a job. Or we have to look at the loopholes where people could earn money or have a lot of assets and still get food stamps. We're going to close the loopholes, which means if you win the lottery, you still can't collect food stamps. These were some common sense reforms that still make sure we're taking care of the people who really need the help from government.
All right. Well, Congressman Sean Duffy, thank you very much for joining us this morning.
Thanks, Sean.
And best of luck to you and your colleagues in Washington.
Thank you so much. We need a little bit of luck. Thank you.
Now we'll check in with Mark.